Hello students, this is Ridhima Shirodkar from Government College of Arts, Science and Commerce, Khandola. Today we will be looking at PSC 105, Understanding Psychological Disorders. The module name is Types of Sexual Abuse, Dysfunctions and Paraphilias, Part 2. It's a continuation of the previous module where we spoke about sexual abuse. Through this module, you will be able to understand the meaning of sexual dysfunctions and the kinds of sexual dysfunctions. And these are the learning outcomes for this particular module. Before I start with this module, I would like to just tell you that sexual activity and sexual intercourse are a part and parcel of human life, and though there is a lot of stigma attached to this, we need to bust these stigmas and understand these topics in a very mature manner. So don't feel embarrassed to go through these videos, and the notes and the quadrants which are attached with this will have more information and more links through which you all can gain more information about these kind of topics. So let's try to understand what are sexual dysfunction disorders. So we must know that sexual activity, as I said, is a part and parcel of human life, and talking or engaging in such kind of activities makes the couple who is there, the partners, feel more connected and more intimate with one another. Couples may at times not be able to take part in sexual activities, either because they feel that they are not in the mood or due to some physical and psychological reasons. Thus, sexual functioning may not be really optimal at all times, and this may interfere with a couple's well-being. Sexual expectations also may differ for different partners. Within partners, one person may not try to understand the expectations of others, and therefore as sexual patterns change as an individual ages, this entire understanding of sexual functioning by itself is quite complex. It becomes very essential to differentiate between temporary sexual problems and a more long-term dysfunction. So when everybody may go through a period of I really don't feel like engaging in sexual intercourse or sexual activity, but this may be very temporary. But when it starts affecting the relationship per se and it causes significant distress to the person, that's when we have to look into the matter. So the DSM-5 in this particular manual, it basically states that for any kind of a dysfunction to be given the name or to consider it as a disorder, it should last for around 6 months, especially where sexual functioning is concerned, and if there are dysfunctions in this, the problem has to go on for 6 months and it should cause significant distress or impairment. So now let's focus on 3 perspectives to understand these dysfunctions. First is the medical or the biological perspective, where individuals having some sort of a medical condition like diabetes or vascular illness, or the ones whose lifestyle involves lack of exercise, unhealthy weight, smoking, etc., they may be prone to develop such kind of disorders, or they may be kind of having such kind of dysfunctions. From a psychological perspective, previous trauma, that means if you've not been able to perform sexually so well, you may experience something like a performance anxiety where you feel really nervous with your partner. Also your upbringing and beliefs, where sometimes you consider sexual matter or sexual intercourse to be a thing which is not supposed to be done. Such kind of things may interfere in your romantic relationships. Again, if the relationship by itself is one which is not very healthy, where one of the partners is quite hurt or there has been a fight or argument, of course the sexual intimacy will be affected. However, good communication does help if you talk it out and sort the issue. Surprisingly, though it is not very reported and because people are very embarrassed to talk about such things, sexual dysfunctions are very common as once was thought, but people don't report it, as I said, because they are shy or things like that. There are various issues which we will be talking about, but some of them are there is an inability to achieve an orgasm. Orgasm is nothing but this heightened sexual pleasure, and many women may report that we don't experience an orgasm as such. Also, there is a lack of interest, there is anxiety related to the sexual performance, pain, etc. It must be remembered that with age, sexual desire does tend to go down, especially in males when their levels of testosterone, that is the sex hormone, starts decreasing, and women when they kind of achieve their menopause, where the menstrual cycle ceases, that is when their estrogen, that is also a hormone, it starts declining, and this may cause vaginal dryness. So because of this, having a regular sexual intercourse may be very painful for a woman. If you look at the DSM-5, the sexual dysfunctions are clubbed into the following categories: desire, arousal, orgasm and pain. The sexual response cycle is an important thing to understand, which has been included in your notes with this particular module. So let's look at the sexual dysfunction disorders in the DSM-5. One of the main disorders which we talk about and which we will deal with is the erectile disorder. This dysfunction is of course found in males, and it involves having a problem in the following areas. Firstly, the particular male will not be able to obtain an erection, that is the penis will not get rigid during the sexual intercourse, or there will be a difficulty in maintaining the erection. It gets rigid but it is not maintained throughout, or there is a decreased penis rigidity which interferes in sexual performance. Of course, this condition will cause significant distress to the individual concerned because it kind of impairs relationships. However, a study also shows that males between 30 to 39 years old have around 2.3% of them do experience this dysfunction, and males as they go into their 50s, 11 to 15% of them will experience this dysfunction. Lifestyle factors are also involved here, like smoking, alcohol abuse, obesity, medical conditions like diabetes, hypertension, and if males are using any kind of psychotropic drugs. Stress and issues with the relationship will of course cause this dysfunction, but the important thing is that it does affect the relationship, and therefore one needs to seek help. Let's look at female orgasmic disorder. This dysfunction is characterized by a female not being able to experience an orgasm or has a reduced intensity of the sensation of the orgasm. As I told you, the orgasm is the height of the sexual pleasure. So many women may report that I don't really experience an orgasm when I am engaging in any kind of a sexual activity. However, this is a little bit of a confusing matter because female orgasm by itself is a confusing matter, where many females may experience an orgasm when they masturbate but not when they are with a partner. So the actual thing takes a little bit of time to understand. The next kind of dysfunction which we look at is called as delayed ejaculation. This is a dysfunction where the male may experience a delayed or no ejaculation at all. This causes distress, and this lasts for at least 6 months. So what is an ejaculation? An ejaculation is basically the secretion of semen and the sperm. The semen contains the sperm after the sexual activity. So sometimes what happens is that the male may experience no ejaculation or a very delayed ejaculation, which can cause a lot of distress and impair the relationship. Again, this issue has to last for about 6 months for it to be said as a sexual dysfunction. On the other hand, there is something called as an early ejaculation, where the dysfunction may be diagnosed when a male experiences an ejaculation within approximately the first minute of the sexual activity. So within the first minute itself, the ejaculation or the semen is kind of released, and again this can cause a lot of impairment in the relationship because the entire intercourse activity is not being completed. This again has to last for about 6 months or more, and it causes significant distress not only to the male but also to perhaps to the partner concerned, and therefore they may require to seek some sort of help. This condition, that is the early ejaculation, was previously called as premature ejaculation, and first when this was reported they used to use only psychological based therapies like psychoanalysis. However, now we know that it can have also a medical or a biological basis, and therefore sometimes they give medications, that is SSRIs, selective serotonin reuptake inhibitors, to help males deal with this issue. So it can have a biological as well as a psychological basis. Looking at the female sexual interest or arousal disorder, the female should experience any 3 of these symptoms. Firstly, reduction or absence of interest, where she does not feel interested in engaging in any kind of a sexual activity. The woman may have fewer sexual fantasies. There will be lesser excitement or pleasure in having sex or during sex, or fewer sexual cues or indications of sexual sensations and things like that. So any 3 of these symptoms have to be present. Again, these may cause very significant distress to the partner as well as to the female concerned, and it should be remembered that sexual desire may decrease with age in women. So that factor has to be taken into mind when the hormones start changing and the woman is reaching more towards menopause. So this disorder may be quite common actually. Looking at the male hypoactive sexual desire disorder, hypoactive means lesser active, so hypo. This is a sexual dysfunction where the male has a decreased interest to engage in sexual activity or even erotic thoughts. Again, this should last for around 6 months and should cause significant distress. As I had told you previously, when testosterone starts decreasing, males may have this issue and their desire to engage in sexual activity may actually reduce. The last disorder which we look at is a genitopelvic pain or penetration disorder, again a very common disorder. This is categorized by two subtopics, as you can say, or there are two categories in this particular disorder. Firstly, there is dyspareunia and vaginismus. Okay. So what are these particular conditions? Let's look at it. Dyspareunia is basically pain experienced during intercourse. So when the penis is inserted into the vagina, or when there is a thrusting motion, what happens is that the particular female experiences a lot of pain, okay, and because of the pain the individual is very upset and disturbed. What are the causes of this? This could be because of aging, it could be because the vagina is really dry and therefore the lubrication is not there, or because of medication, okay. So this is a very painful condition for the female concerned over there, and this of course will interfere with the entire experience and the entire sexual experience. The next disorder is vaginismus. It is of course related to the vagina, as the name itself suggests. So what happens is that when anything, even if a gynecologist is trying to kind of insert a speculum for a test, or the penis or the finger, anything is inserted into the vagina as well as the pelvic area starts going into spasms. So spasms are basically recurrent pains where they kind of, they contract and the individual gets extremely afraid, and there is fear associated with this, and because of this, penetration by itself becomes impossible. Okay, so even when you go to a doctor, the doctor is trying to test you, and if you feel that something is being put into my vagina like a tampon, you will get a spasm at your muscles near your vagina and your pelvic area, and therefore this penetration is not possible at all. Of course, this will impair the sexual relationship. So these are the differences. The main point is that sexual dysfunctions are very common, and you require to seek help if you feel you or your partner are kind of going through this. You should bust the stigmas associated with sex by itself, because it's a part and parcel of life. Thank you.